Okay, you may be curious as to what they just voted on, and let me read it to you. As a starting point, the board recognizes that the work and contribution of TriMet employees is the primary reason that our agency has been so successful in providing outstanding transit service. TriMet's hardworking and innovative employees were selected to receive the APTA Innovation Award in recognition of participation in the PIP and the ability to process to fully engage frontline employees in finding ways to improve agency efficiency, improve the work environment, save money. The board is, however, aware that the severe financial challenges caused by the current economy, and that's the only thing, has forced TriMet to lay off staff, cut expenses, and reduce service. Before reducing service to our customers, in addition to taking into account the savings realized by savings generated from PIP, TriMet implemented a 2009 salary freeze for management personnel, required furloughs, aka vacations, and left jobs unfilled to take advantage of salary savings. The board hoped that our economy would rebound quickly, but now it looks as though TriMet has another year of reductions and tough choices. Based on past trends in wages and benefits, the current estimate of revenues, there is a need to cut $27 million agency-wide. Although the measures that TriMet has taken to generate savings are necessary to produce a balanced budget in the near term, TriMet also needs to take additional steps to create a sustainable financial structure that will allow us to continue to fund ongoing and growing commitments. TriMet's growing costs of employee wages and benefits, as well as retiree health benefits, will limit our ability to maintain and expand service to meet the needs of the public. The board believes that ultimately all TriMet employees must carry their fair share of the burden of both greater customer demand and dwindling resources. We must also ensure that our health, retirement, and compensation plans are competitive with the market, the free market. There we go. The thing that has failed America, the free market. Here we have it in here, though. Compensation plans are competitive with the market, allow us the ability to recruit and retain employees, and help our customers and constituents benefit from the high quality and expanded, you mean the never-ending expanded transit service that we're now going to have to pay for. That's us, the employees. Okay, we're back. One specific area that TriMet board believes need to be brought in line with what other governments and businesses provide in this region is healthcare costs. Over the past 6 years and in 2010, we have seen healthcare premiums for our employees and retirees increase by more than 70%. This is not sustainable. Where's the charts, please? We have made a number of changes to management healthcare plans that will result in a 3% increase in 2010 premiums. However, for a significant portion of our workforce that is not covered by management, we are facing increasing healthcare costs in 2010 of more than 22%. Where's the charts? Where's the charts? We don't want to just see numbers. We want to see charts showing us what this is. The national debate around healthcare is a mirror of what we are seeing in our own healthcare costs and plans. TriMet General Manager has made it clear that TriMet's goal with respect to healthcare coverage for our employees is not a race to the bottom. That's funny. Our goal is to create a health plan that provides high-quality, comprehensive health care that is in line with coverage and costs of other plans provided by state and local governments in our area. The board understands the working wage agreement with the ATU expired and that TriMet and ATU are currently negotiating the terms of the new working wage agreement. The board's goal for working wage negotiations is to bring TriMet's health care and post-employment benefits in line with sustainable financial forecast of future TriMet revenues. We believe it is essential for recruitment and retention of an outstanding workforce to provide quality benefits. At the same time, we must have a benefit program that reflects partnership between TriMet employees, retirees, where each party shares in a responsibility for health care. TriMet's wages and benefits must be in line with overall compensation of other employees in similar services and with those other employees in comparable communities. To be sustainable, the future cost of TriMet's benefits should not grow faster than the growth of TriMet's underlying payroll tax. Okay, well, nothing, I don't have any problem with the basic premise, but, when you keep growing the system and you keep adding services, you're going to add to the employee benefits because you keep growing. You won't stop the growth here. I mean, you expected, these people expected the payroll tax to go up forever, I guess. You know, first of all, I want to see some facts and figures. We're not even number one in the transit industry. We're number 7. That's 7. That's not even in the top 5 for healthcare. Okay, number 7 in the transit industry. And I want to see charts and figures which outline the plans of all the other county, state government workers in our local area and all the other transit districts. I think we should see the top 10. We should at least, you know, TriMet says they're number 1, they're a world model, but here they are. They say they don't want to be in a race to the bottom, but that's exactly what they're doing. They're in a race to the bottom. Their unsustainable growth, which is what has really caused this problem, is now being taken out on us. We understand there's a payroll tax problem, but you can't keep expanding a system in the face of declining revenues and then ask your employees to pay for it. I want to make another point too. I'd heard years ago that this was part of a strategy that was going to unfold. They want the management or people pulling the strings, whoever they are. We don't really know who they are. Fred is the figurehead, of course. He's the one that takes the flak. But people are pulling the strings of TriMet and of the United States in general, state, whoever they are, had a master plan, and that was get the rails in, get the West in, get the green light in, and then bust the union. Okay, now it's very coincidental indeed, isn't it, that this is all coming up right now. The green light is in, the West is in, and Fred is bailing. And now they want to take away our health benefits. And the shit's going to hit the fan here. I'm telling you, the shit is going to hit the fan in this agency. All the signs are there. All the management is going or gone. This is up right now. They don't provide us with any facts or any figures. They just hit us with this information. And obviously, the shit's going to hit the fan. Okay, anybody that doesn't see it coming is pretty stupid. I mean, I'll be shocked if something bad doesn't happen here. And we already know that Fred bails when the going gets tough. When the shit is hitting the fan, you'll never find Fred anywhere, okay? Because that's been his pattern all the years I've been watching him. He disappears. He'll send the dish rag in or somebody else, but he ain't going to deal with it. And this is a great opportunity for him to go. He's got his stupid ass rails in for whatever the hell good they are. And now he's made his millions, and he can go live happily ever after and just leave the shit for the rest of us to deal with. And that's exactly what's going to happen here, folks. Mark my words. I don't like it. I don't like it. I don't like it.